Welcome to Facts TV News, where everything is true. Man killed near canal in Spanish Town. A man was shot and killed in Etham Phase 3 in Spanish Town, St. Catherine yesterday afternoon. He is yet to be identified. It is reported that about 1 p.m., residents heard explosions in the vicinity of a National Water Commission pump station in the community and called the police. Upon their arrival, the man's body was found on a dirt track near a canal with multiple gunshot wounds. The body was removed to the morgue for post-mortem. MAJ President warns of post-COVID inflammatory reaction in children. President of Medical Association of Jamaica, MAJ, Dr. Brian James, is urging those in the health system to be on the lookout for multisystem inflammatory syndrome, or MISC, that affects children. This syndrome is an inflammatory reaction in the body after 4 weeks after infection with the COVID-19 virus. His call comes amid reports that the Bustamante Hospital for Children has seen an increase in infected patients who have been displaying symptoms of MISC.
The symptoms of the multisystem inflammatory syndrome, MIS-C, include fever, rashes, red eyes, diarrhea, and vomiting. The inflammation can also affect the heart, blood vessels, and other organs, which can make some children very ill and in need of urgent care. MAJ President Dr. Brian James told Nationwide News on Sunday that MIS-C is a severe illness that can occur even after being asymptomatic with COVID-19.
One of the big problems with getting COVID of any variant in children is that there is a potential for multisystem inflammatory syndrome. And this is a really very severe illness that can occur even after asymptomatic COVID. It has been recognized. We've had a number of cases in Jamaica, although not in this wave that I'm aware of so far, but it is a potential. And what happens is that the body's immune system becomes very, very fulminant in its response to the COVID.
The MAJ boss says the syndrome also affects the major organs in the body.
Affects all of the major organs in the body, particularly the heart, the liver, the kidneys, and it can really cause very, very severe disease. A number of these children have had to be on ventilators in various jurisdictions, including Jamaica. So we are concerned that, particularly with children out in face-to-face situations, that the disease might actually be spreading quite significantly in the children.
He explained that finding out if a child has the syndrome may require a test to ascertain if the child had COVID-19.
A number of times we only pick up that the child had COVID by doing the COVID antibodies and realize that they have antibodies and now they have this syndrome, which is a sort of hyperinflammatory type syndrome.
According to reports, the Bustamante Hospital for Children has recorded a spike in COVID-19 patients being admitted to the hospital. Reports are that some children who tested positive for COVID-19 had respiratory symptoms including cough, runny nose and fever, and gastrointestinal conditions such as vomiting and diarrhea. Efforts by our news team yesterday to contact the senior medical officer at the Bustamante Hospital for Children, Dr. Michelle Ann Richards-Dawson, was unsuccessful.
Women in Manchester restores agricultural projects for community development. In an effort to continue empowering rural women in the parish, the non-profit organization Women of Manchester, WOM, is seeking to expand its operations and help those it serves become more self-sufficient. With approximately 5 chapters across the parish and approximately 300 members, the organization, which was started by senior citizens who wanted to give back to the community, managed to secure sponsorship from Food for the Poor in the form of agricultural equipment and a greenhouse to plant 600 trees of onion seeds before the start of the pandemic in the Misfa community. However, following after the onion farmers were supplied with the seedling of planting, the operation was crippled by the onset of the COVID-19 pandemic. We haven't been very active since then. We just started again. We received another package of seeds from RADA, Rural Agricultural Development Authority, and we started planting. We have some that have gone out already, and these are the second lot, but we want to fill the house again and keep it rolling, explained Vice President of the organization, Denise Walters. Dedicated to changing the landscape of women in the parish of Manchester, the president of the movement, Myrna Bailey, said WOM has been able to successfully undertake several other initiatives, which they hope to continue. We started a school feeding breakfast program. We partnered with the Trees That Feed Foundation, who gave us trees like ackee and breadfruit that help give people enough to eat and sell, and we also taught them how to make breadfruit flour. We have also, through Food for the Poor, helped persons to get housing. What we try to do is match resources with people who are in need of the assistance. Bailey said she is hoping that the initiative will be spread across other parishes to help other women become self-sufficient through the assistance of local and international funding agencies. Recently, the MISFA chapter of WOM engaged French ambassador to Jamaica, Olivia, who indicated that an assessment will be done to see if support can be given to the organization. I have to figure out how my office can do something for the community. I would like to serve my embassy, the products which are grown here, and to see what we can do here in the future, she stated. Project manager at the MISFA site, Levine Miles, and volunteer coordinator Leon Sams says plans are now underway to have a build-out in agro-processing. 3 years ago, we planted pop choy, cabbage, Irish potato, carrot, sweet pepper, and among other seedlings. And when we sold those, we used the funds to buy ingredients to make sweet potato wine, and this is the first of our venture into agro-processing, Miles said. Sams feel that there are plans to have it tested and approved for market consumption, driving the mandate of helping women engage in activities that will produce monetary benefits. He added that the group is now engaging the services of RADA to start its new project of producing strawberries. Police Commissioner indicates constabulary needs 6,000 more members. Commissioner of Police Major General Anthony Anderson says it would take an additional 6,000 policemen and women to make the constabulary's operational thrust stronger. He says the constabulary will be actively recruiting new members soon.
This financial year, we're going to recruit upwards of 1,200 new officers. It's the highest number that have ever been recruited in a year.
And that will take you up to what number?
That will give me a plus 12,000 plus. Well, 12,500. We established our numbers at 18,000. That's what we need. Okay? And we did that not by pulling a number out of the sky.
Yeah.
We did that through a very scientific method and testing this method against experienced officers who police stations, station areas. The number is 300 plus. I got slowed up a little bit in COVID in terms of building that capacity, but also all of the other, both the technological things that have been added to the force and that we are adding, those are back on track. So, in my engagements with policymakers, there's a continual advocacy for the resources required to do this. Now, some of it is ours. So we had to build the capacity to do proper force generation.
Omicron could be a godsend, says Frey. Dr. Delroy Frey, clinical coordinator of the Western Regional Health Authority, WRHA, believes that Omicron strain of the virus, which causes COVID-19, could be a godsend to herald the end of the pandemic, with the world moving into an epidemic stage with pockets of infection and occasional surges. Frey was speaking with reporters last Friday as he gave an update on the impact of the fourth wave of the pandemic on the public health systems in Trelawney, St. James, Hanover, and Westmoreland, which fall under the WRHA umbrella. It is my view that COVID-19 will become endemic locally and abroad, where occasionally there will be a surge, but the vaccinated will not have much difficulty, he stated. We're seeing the effects of the fourth wave, but we have no evidence that it's Omicron, Frey stated, referring to the current variant of the virus now being blamed for a surge in cases across the globe. Up to 3 weeks earlier, the number of coronavirus cases I had at each facility was under 10, and Thursday, I had 57 patients at Conroe Regional Hospital alone. While the highly transmissible Omicron strain is yet to be officially confirmed in the island, a visitor to the island has tested positive for the variant on returning to the United Kingdom late last year. What we are dealing with is less lethal coronavirus, and it could be where the Omicron, that is my clinical suspicion, and the Omicron strain might be God sent to kill coronavirus. What is going to happen is that everybody is going to catch the Omicron, then we are going to become immunized and we get herd immunity, Frey said. Then, in another 2 months, you will see the level go right down and we reach an endemic stage. With roughly 130 healthcare workers now recovering from COVID-19 amid a steady increase in the number of patients affected by SARS-CoV-2 at hospitals in Western Jamaica, Frey believes that based on lessons learned during the third wave of the pandemic, his team can stay afloat. Among healthcare workers now in isolation due to COVID-19 are senior doctors, emergency ward nurses and porters assigned to Conroe Regional Hospital in St. James, Noel Holmes Hospital in Hanover, Falmouth Hospital in Trelawney, and Savanna Mar Hospital in Westmoreland, where 99 patients were being treated for the virus late Friday. Some 98% of those currently hospitalized were unvaccinated against the virus. Frey said, noting that the continued resistance of jobs and flaunting of protocols could be behind the spike. On the other hand, more healthcare workers are being vaccinated, leading to a quicker recovery from the illness. Unlike the last wave, more healthcare workers are falling ill and have to be off work. However, the recovery rate is expected to be swift, as the fully vaccinated among doctors and nurses are at 96% and 60% respectively. Most have also received their booster shot, Frey said, adding that more people are recognizing the importance of being jabbed. We see a steady increase in hospitalization, but we are not panicking, he said. Should we get a sudden increase, we can deal with it because the last surge taught us a lot, and we were able to treat 120 very sick patients to give them the best care that we could. Conroe Regional has 57 confirmed and 14 suspected cases, but some patients are being housed at the field hospital in Falmouth, Trelawney. The Mount Salem-based health facility is operating without 76 of its staff, including 23 doctors and 47 members of the nursing team, but this is an improvement from the 100 workers on sick leave the week before. The least affected hospital under the WRHA is Noel Holmes Hospital in Lucy, where only 1 member of staff was in quarantine up to Thursday, while 12 patients were being treated for the virus. At the Savanna Mar Hospital, 5 doctors along with 27 nursing staff were in quarantine on Friday, while there are 18 patients hospitalized. 22 patients were being treated at Falmouth Hospital, where 2 doctors and 18 nurses reportedly in quarantine. Demand for medical oxygen across the region has fallen by 10% from the 30 to 40 liters per patient previously needed. According to data provided by the Ministry of Health and Wellness, Jamaica has recorded 118,727 confirmed infections up to last Friday. The Kingston and St. Andrew region continues to lead the island in terms of infections, with 31,842 confirmed cases since March 2020. St. Catherine, 21,638, St. James, 12,430, and St. Anne, 8,845 follow. Most of the 1,010 cases recovered last Friday were seen in Kingston and St. Andrew, 292, St. Catherine, 217, St. James, 94, St. Mary, 83, and Trelawney, 51. All other parishes recorded fewer than 50 confirmed infections on the day. Please remember to subscribe, like, share, and click the notification bell for daily updates.